Well, good afternoon, conference, and hasn't it been a fantastic conference? And the weather has come out for us today. It's a different ball game, and it's been a pleasure to be with you all. So let's talk health. Wales deserves a health service that works, not just materially, but for us, the people of Wales, and the Welsh Conservatives can deliver it. Our hospitals should be places of hope, reassurance, and recovery, but this is far from reality. Now, one patient who attended the University Hospital of Wales A&E recently described it as a war zone. Another described feeling that they'd made it into the system and would be okay, only to find the reality was not so true, describing people waiting for hours to be assessed, crying out in pain, with patients helping each other as there was no one else there to help them. And another said they thought that people will die in the waiting room. And that is such a powerful and frightening statement, and is sadly one that is backed up by the Royal College of Emergency Medicine, who found that more than 900 deaths in 2024 were associated with long A&E waits here in Wales. Now, this is not the fault of our great doctors and nurses, as we've just heard, and all of the allied staff which support them, who give their all to our NHS and to our patients and to their patients. This is about systemic failure caused by 27 years of Labour mismanagement, and we know they've been propped up by Plaid Cymru and the Liberals all through that time. Surely 10,000 patients waiting 12 or more hours in A&E during December is not just a winter blip. It's the result of Labour's rule. 1 in 4 people in Wales stuck on a waiting list. Nearly 7,000 people waiting for over 2 years, and barely half of cancer patients starting their treatment on time. Conference, would you believe it? In Wales, you are 375 more times likely to be on a waiting list for over 2 years than in England, with only 177 people in that position in England. Now, let's remember, in England, the population is 58 million. In Wales, it's just over 3 million. So this isn't normal, and it must not be the status quo. Why should the Welsh people settle for less? Labour and Plaid Cymru have underfunded our NHS for so long that it has become the norm, but it doesn't have to be this way. Despite these statistics, caused by over a quarter of a century of that mismanagement by Welsh Labour, hope is not lost. The Welsh Conservatives stand ready to turn things around, drastically improving the health outcomes for Wales. Conference, until you acknowledge there's a problem, you can't put it right. So, as we've heard already, a Welsh Conservative government would declare a Wales-wide health emergency on day one. Now, this isn't a slogan nor a political theatre, but a mechanism to mobilise every part of government behind one objective: fixing the NHS. Conference, today, we launch our manifesto on the NHS and social care in Wales, because only the Conservatives have a plan to fix our health service in Wales. Now, we would improve recruitment and retention. We've heard how important that is in the Welsh NHS, giving our health service the staff it needs. Clear the unacceptable NHS waiting time backlog, as patients cannot afford to wait. Establish an NHS efficiency task force cutting waste. Immediately reopen closed wards to support step-down care. And we would end corridor care, as we talked about earlier. We would review hospital bed capacity and increase funding in real terms every and each year of the next Senedd. We would improve funding for consultant and specialist nurses, modernise our NHS through AI and technology so that doctors can use the most innovative treatments for patients. We would overhaul screening, introduce a national prostate cancer screening program, and promote healthy eating and lifestyles because prevention is essential. We would increase spending for mental health and treat it with the same urgency as physical health. Improve standards, governance, and safety within our health service and eradicate poor leadership. And we conference would improve access to GPs with a guarantee patients will not wait longer than 7 calendar days for an appointment. We would develop a network of surgical hubs and diagnostic centres, establish new minor injury units, and develop national delivery plans for Wales' 4 biggest killers: cancer, heart disease, stroke, and dementia. And we would establish an NHS Wales Reserve Service, a bank of trained and vetted volunteer staff to draw on in those emergencies and peak periods. Our plan to fix health and social care will deliver better hospitals, improve services, promote choice, and provide the person-centred care the people of Wales deserve. That is what success looks like. And that is what the Welsh Conservative government would deliver. Conference, we know how many people fear that when they enter later life and need to access care, all they have worked for can just get sucked away in care fees. Now, we believe people in residential care should not lose their life savings. So we would increase the capital limit to £75,000 before people pay. But conference, fixing the NHS is not just about treating illness, it's about preventing it. For too long, Wales has been trapped in a cycle of late diagnostics, late intervention, and late treatment. We wait until people are seriously unwell before we act, and then we wonder why our hospitals are overwhelmed. That is not a sustainable model for a modern health service. A Welsh Conservative government would break that cycle by putting prevention at the heart of our Welsh NHS. We need to help people make better choices that will ultimately lead to healthier lives. Now, that is the role of government, not to dictate or control every part of people's lives, not through heavy-handed, top-down interventions, but through practical interventions that work with families and communities. The Welsh Conservatives would give every child in Wales the best start possible in life because the evidence is overwhelming. Prevention in childhood leads to healthier adults and fewer chronic conditions and a stronger NHS. Now, this is not just health policy, good health policy, it's proper leadership, which is what Wales has lacked under Labour all of these years. Now, prevention reduces demand, improves outcomes, and frees up resources so our NHS can focus on those who need it most. And conference, prevention is not separate from our plan, it's firmly in it and strengthens it. Our 7-day GP guarantee, our diagnostic centres, our surgical hubs, all these reforms work better when fewer people reach crisis point in the first place. And we need also to invest in our crucial primary care providers, GP practices, our pharmacies, our dentists. All are absolutely fundamental services, but they're currently really struggling. Prevention makes our NHS more resilient, more efficient, more affordable. It is how we build a health service that is not just surviving, but thriving. And that is what success would look like under the Conservatives. We cannot see a continuation of war zones in our A&E, patients treating and supporting other patients because the staff are overworked, and crucially, the perception of A&E being one of dread and despair when it should be one of hope and recovery. Conference, this is the opportunity for Welsh Conservatives to show that change is possible, that our Welsh NHS can be a beacon of hope, and that it can achieve what it is set up to do. We cannot go on like this. Labour and Plaid would continue to underfund the NHS, say nothing needs to change, but demand more money. Whilst Reform, well, we know them, they haven't got a plan about anything, but they would still say the model is broken and the only solution would be to privatise it. And they're both wrong. Only the Welsh Conservatives believe in the NHS as the public service it was meant to be, free at the point of use, but run competently, efficiently, and that promotes independence. After 27 years of Labour control, it's killing our NHS. Too many budgets passed via backroom deals with Plaid Cymru, support, and, they've starved our NHS. Wales cannot afford another wasted moment. Wales deserves a government who will not just fund the NHS, but fix it. Only the Conservatives have that plan. Only we have the urgency, and only we will put patients first. Let's stand together and fix Wales. Diolch.